quality services, you can do that at reduced costs. And the other thing about local services is that they are better placed to detect and monitor what's going on and to identify poor quality and abuse when it occurs. So what's stopping change? I mean, when we started the review engagement process, a lot of people said to us, we know what needs to happen. So why is it that change isn't happening? We've seen all the Mansell reports. What needs to change? And it's true, there is a good solid evidence base of how people with learning disabilities and challenging behaviours need to be looked after and cared for in the Mansell reports. But we know that this knowledge isn't applied everywhere. And what people said to us as part of the review was, we don't know how to do it. We know what needs to be done, but we don't quite know how to get there. And I think part of that is about, for some people it is lack of understanding or knowledge about what needs to happen. But it is also about a failure to develop and maintain the necessary local services and the local partnerships which can deliver the required model of change. And I think there are a number of problems or points of confusion that we've identified as part of the review. And the first one is that people often confuse the process of assessment and treatment with assessment and treatment units, the institution, because it is, people will always need assessment and treatment services, but they won't always need inpatient assessment and treatment units. And where people do need, for a small number of people, they may need to go into inpatient services. But where that is the case, with the right reasonable adjustments, these can be provided locally in local mental health services or safe houses. There are also issues around hospitals being treated as homes for people, which is not what they're meant to be. People should only be going to hospital where there's a defined purpose or reason for doing that, and it's clinically justified. And equally, it's about local services taking responsibility for out-of-area placements. And all too often, there are a number of problems when people are in out-of-area placements for a long length of time. For a start, local services may lose touch with what is happening to the person and understanding about their situation. And they may take at face value the views of medical experts that somebody still needs to be there without really looking into the situation. There may be concerns about who has long-term and short-term responsibility for the individual, and planning and moving back into the community. There may be issues about responsibilities there. And it's also true, I think, that for many people who are in out-of-area placements, there is a failure to plan from childhood. And for lots of people with challenging behaviour, these are people that have been identified very early on from childhood. Services often know who these people are, and yet if they end up in out-of-area residential schools, the chances are that they will move on to out-of-area places to live in adulthood as well. So our key objectives are about redesigning services, and that's around the needs of the individual and their families, and it's about developing more localised and personalised care. And a real critical part of this is about developing good collaborative joint commissioning and planning of services across health and social care, supported in the best practice areas that we've seen by pooled budgets. It's about clarifying the roles and responsibilities of the different parts of the system so that everybody is clear about who needs to do what. And it's about better integration of local services. So where there are good community teams which are integrated, involving health and social care professionals, these are areas where better services are being provided. It's about providing good quality care and promoting positive behavioural support and reducing use of restraint. So what we're trying to do with the Department of Health Review is to set out a programme of action, or a programme for change. And this is building on the 14 national actions which are in the interim report. And the programme will focus on action which will ensure joint health and care planning and commissioning of services, and starting from childhood. It will be about incentivising the right model of local responsive personalised care, and so preventing the placing of people in inappropriate assessment and treatment settings, and driving up the quality of care in specialist health and care settings. And finally, we need to know what change is happening, so we need to ensure that there's robust monitoring of progress in this area. And I want to speak a little bit about planning and commissioning, because I think this is critical to making change happen. Because the aim is to develop genuine joint planning and commissioning of services around the needs of individuals and their families. And part of the difficulty that we've had with the review has been the timing with the current health and social care reform agenda, with the NHS Commissioning Board, which will be playing a critical part in this, not being fully in place until the start of this month. And in fact, it doesn't legally take up its full obligations until April next year. So we're still in a transition phase from the old system to the new. And that makes it very difficult to set out in a report how change will happen and what the key players in that will be doing. But we are talking very closely to the NHS Commissioning Board about their roles and responsibilities in developing better commissioning across health and social care. And we're working with the Directors of Adult Social Services as well to develop a model specification by March 2013 for learning disability services. And I think that will really help to clarify what is the best model of care and practice that we expect for people with learning disabilities. And in addition, NICE are developing clinical guidelines. So I think there will be much stronger evidence and support there for people in the future. But in terms of planning and commissioning, it's critical that the NHS Commissioning Board support clinical commissioning groups, CCGs, to work together collaboratively in commissioning, because they're going to be covering smaller areas than the current PCT clusters. And it's also really important that the NHS Commissioning Board works with the Local Government Association and ADAS to promote joint and collaborative commissioning across health and social care, across CCGs and local authorities. So that's a part of the work that we are still trying to push forward as much as we can at the moment. And I've said a lot about inpatient services and the need to ensure a rapid reduction in the number of people in inpatient assessment and treatment services. There's always going to be a role for inpatient services, because hospitals are often the place which is best able to provide a safe environment for people, either because of a risk to themselves or to other people. But as I've said before, this is about them being there when they only need to be there because it's clinically necessary and appropriate. And the process of assessment and formulation is about trying to develop an understanding of what that person needs to enable to support them to live better in the community. And this slide here, I'm not going to go into the details of this, but I think you've all got copies in your pack. This is a slide which is taken from one of the examples of good practice that was published alongside the interim report. We published 3 examples of good practice, Salford, Cambridgeshire and Tower Hamlets, and this is from the Cambridgeshire case study. And that sets out what approach they've taken to developing good local integrated services working together. And they have teams which support people with intensive assessment and treatment in the community, as well as small number of inpatient services. And I recommend that you look at those examples of good practice if you're looking at how to do this better. And just to say, we will be republishing those alongside the final report, along with other examples of good practice. We're keen to hear from anybody who's got examples of good practice that we can include and help facilitate that being shown.